Hi, this is James from Cerritos Dental Implant Center. So we're going to make another video today, basically on the next topic that we hear a lot people ask about is, what type of bone graft material do you use? So there's only 4 types of bone graft material available on the market right now. The first is xenograft, which is basically bone that comes from different species, in this case animals. The next is allograft, which is donor bone that comes from humans. And the next one, autograft, basically donor bone from yourself. So we just harvest, the piece of bone from your mouth or a different body part. We graft that into where we want to place the implant. And the last is alloplast, synthetic bones. Basically, it's something that doesn't come from living organisms. So people might ask, why bone graft? Oh, I don't think bone graft is necessary. We hear that question a lot, right? Implants are not cheap. Bone graft only makes the implant costs go up. So why do we want to have bone graft? Well, if we take a look at this slide right here, we see that this is an implant, an abutment, and a crown. The entire implant structure itself has to be completely encased in bone. If any portions of the implant threads are showing, bacteria is going to get in. And if you remember from our previous videos, that if any portions are showing or bacteria gets in, that's very bad for the implant because bacteria is going to start eating away and chomping away at your bone. Not a good deal. Okay, so in terms of why do we need the bone graft? Well, I should take a look at a live case right now. So this case is actually a sinus lift. So we're not going to get into what a sinus lift in this video. I guess that'll be another video for another day, but just know that this is a sinus lift and this patient needed a bone graft. So this is the same patient, different x-ray. And this is a patient's panoramic x-ray, so basically a full mouth x-rays. So the area that I want you guys to focus on is on the top left corner. See, that's all the patient's bone that he has. So patient needs to have 3 implants placed in this case. So in this case, he doesn't have enough bone or natural native bone in his own mouth. So therefore, grafting procedure is needed to build up enough bone to place the implant. Okay. If we see here the x-ray on your left, that's an implant simulation to simulate the 3 implants that are going to be placed. The one on your right, these are the actual implants that are placed. So very similar, and we're going to go into detail of why this patient needs bone graft. So out of those 3 implants on the implant simulation, you see there's 2 different colors. There's a pink portion on the top and a blue portion on the bottom. So the pink portion, if we take a look at any of the x-rays, represents the implant body. So if you remember from our previous videos, every implant has 3 components: the implant body, implant abutment, and implant crown. So in this case, if you see the first 2 x-rays on your left-hand side, well, if you were to place the implant, there's not enough bone. Parts of the implant are protruding from where the bones are, especially near the top part. That black area, that's in the sinus. So patient does not have enough bone, so therefore grafting procedure is necessary. The blue portion that represents the implant abutment. The implant abutment doesn't need to be in bone. It's only the implant body itself that needs to be in bone. Okay, so this is basically the patient post-operation. If we look at the top left of the x-ray where the 3 implants are placed, you see a lot of white stuff in there. That white stuff in there is everywhere that was grafted into the patient. So that's all new bone that's going to be turned into the patient's own bone at one point. Right now it's just grafting. The bone hasn't matured yet. Bone grafting, unfortunately, is a very long process, but this case just basically illustrates why you need to have bone graft. You want your implants to last. Think of bone as a foundation for the implant. Much in the ways of, you think of concrete or foundation for a house. The more stable your foundation is for the house, the longer the house is going to last. Same thing with implants. If you have very strong bone, very good foundation to have your implants placed, well, the implants are going to last you a good long time. So if you see last x-ray here, before and after. So on the top, this is the patient's bone from before. On the bottom x-ray, that's the patient's bone after. So a significant amount of bone was grafted in order to stabilize the 3 implants that were placed in this patient's mouth. Now that we have gone over the reasons of why you need to have bone graft, we move into the different types of bone grafting material. The first is xenograft. So xenograft essentially means any bone structure that comes from a different species. The most commonly used animals to harvest bone is generally from cow, pig, or horse. So the picture that you see right here, the scatter-like white particles, that's actually xenograft. So from this one specifically, it's cow bone. So, okay, that's what you see right here. So what's good about xenograft and why do people use it? Well, xenograft, number one, is osteoconductive, essentially meaning that because it comes from a different species, xenograft will not regenerate bone by itself. It doesn't really stimulate any bone growth in your body, but it keeps the space or scaffolding in order to allow bone to regenerate. Xenograft has a long history of use in dental implants. Bios is an implant bone graft company that has been around for a long time. They use cow bone. They have years and years of research behind their product. And also, xenograft is very popular in both Europe and Asia. So with European and Asian countries, there also is this issue that it's very hard for them to get allograft, which is human bone. There's taboo in a lot of Asian societies that you're supposed to respect the body. So therefore, a lot of places in Asia, they don't have bone banks like we have here in the US. So which leads a lot of those dental practitioners to really have to use xenograft. Same thing with Europe. Europe does not have the bone banks that we have available in the United States. Therefore, most of the practitioners in Europe, they all use xenograft. In terms of do brands matter for xenograft? Not really. Most of the bone, it's all pretty much the same. So, and the last thing regarding xenograft is it's going to stay in your body for about 8 to 9 years. Xenograft, because it comes from a different species, take a very, very long time to turn over. So the example I like to give people is, cells in your body. If I meet you this year and I meet you 1 year later, you're still the same person, but every cell in your body would be different. With bone grafting material, it's essentially the same thing. Your body starts slowly converting these bone particles into your own bone, but just for it to churn these bone, it takes a very, very long time. The next type of material that we're going to get into is allograft, which is human bone. So if you see from this picture right here, the allograft essentially looks just like the xenograft. So allograft, xenograft, if you were just to look at them close up, you really can't tell much of a difference. They look exactly the same. These are both freeze-dried bone, so processed a little bit differently, but you're not really able to tell which one is which, unless you know what you're looking at. So the reason of why people use allograft, as we mentioned before, allograft is also osteoconductive. It can hold the space while you wait for bone to regenerate, but another good factor of allograft is it's also osteoinductive, meaning that it basically induces or stimulates bone growth as well. That's something that you do not get from the xenograft. One downside for allograft is it gets absorbed in the human body much faster than a xenograft. As we mentioned before, it possibly takes about 8 to 9 years to turn over all of that xenograft. Human bone, it could be absorbed in your body within 3 to 4 months. So the turnover rate is much, much faster. And with that, there's good and bad. Sometimes you want to regenerate bone fast, but you also sometimes don't want a bone to turn over too fast, because if you turn over too fast, you lose whatever horizontal or vertical height of what you're trying to achieve. So if you're trying to graft a very large region and you need a lot of bone to regenerate, sometimes you don't want the bone to turn over that fast. Another fun fact when you use people, if you ever come into bone graft or if you need to use it, is for dental implant repeat. One thing to keep in mind when you're using allograft is always use mineralized allograft. Never use demineralized allograft. Demineralized allograft is sold on the market. A lot of it's advertised towards dentists, and a lot of dentists actually use it in towards implant dentistry. So with that, the caveat is never use it. Why? Because demineralized allograft was actually invented for spinal fusion. With spinal fusion, it's basically the bone that they were trying to generate, it's softer bone. It's not dense like the bone in your mouth. So for bone in your mouth, you always want to have mineralized bone, because the bone that grows from that, it's going to be much stronger, much denser bone. So just keep that in mind. So our office protocol now that we've gone over allograft and xenograft, is to actually use a 50-50 mixture. And why we use a 50-50 mixture, as we said, is you get both, essentially get the best of both worlds, right? You get the osteoinductive and osteoconductive properties of xenograft and allograft. And also, because it turns over so much slower in your body, it gives you time to regenerate good bone. So you want that nice, dense bone when you place your implants because, as you said before, you want your implants to last. So the next topic we're going to move on is autograft. So autograft is bone that's harvested from your mouth. And there's different types of ways to harvest it. We can either do it from a block bone, or we can scrape different parts of bone and have that implanted in your mouth. So if you take a look at the picture on the bottom right here, where you see this little kind of like tape portion, that's basically where areas of bone that people generally harvest in order to do autograft. Okay. So if you were to do block bone or block graft, this is what it would look like. So you see there's two screws, and where that two screws were screwed in, that's the bone that was harvested from another part of the patient's body. And then from that, it was taken and transplanted to this side, and this is being grafted here to build up the bone, to repair whatever bone defects the patient had in his original jaw. Downside for autograft is it requires an additional surgery. So this is why autograft is sometimes less commonly used now than it was 10 years ago, because you always have to have an additional surgery to harvest another piece of bone, whether from your jaw, whether from your hip, or another part of your body. And a lot of patients don't like to go through that additional surgery, right? More surgery, more pain, more complications. And on top of that, anytime you do a block bone graft, there's also a level of unpredictability. Block bones are not always 100% predictable, because you take a piece of bone, you transplant to another piece of to some place in your mouth. Sometimes the bone regenerates and grows back, sometimes it doesn't. It's not 100%, but in the world of implant dentistry, nothing is 100%. So the main reason why autograft is just, it's starting to fall out of favor in some areas is just because of the additional surgery. So on the topic of autograft, there's actually been advances in dentistry that now allows you to have your teeth made into basically bone grafting material to be used in implant dentistry. So if you see from this picture right here, this is just a tooth that was extracted. In the second picture, if you follow the arrows, they just cut that tooth in half and then they poke holes in it. After they poke a bunch of holes in that tooth, they put it in the machine called a VacuSonic. And this VacuSonic machine actually decalcified the tooth. So you're going to say, well, why do you want to decalcify? Why does it matter? Well, people have, before, even 10 or 15 years ago, people have thought about using teeth to make into bone grafting material. But the problem is, if you don't decalcify tooth, basically bone cannot regenerate. Basically, I'm not sure if any of you know, but let's say you're pulling a wisdom tooth or you pull out a tooth. If one of the roots tips of the tooth gets broken and lodged in your jaw and you don't pull that out, will new bone regenerate, basically convert that tip and turn into bone? No. You're just going to have a piece of root tip in your mouth forever. It's just going to stay there as it is. So before 10 years ago, people were just grinding up teeth, saying it's bone, and then they transplant that back into the patient's mouth. Problem with that is these are just bone shards. They never actually turn into actually grafted bone. So the cool thing about the VacuSonic and what the advances that it made is, once you decalcify a tooth, basically take most of the calcium out, your body is able to turn that tooth over and you're able to create bone from that. So a very cool concept. Essentially, VacuSonic was actually created in Korea. So a lot of new implant technology is actually not even done in the United States. One unfortunate thing about that is because we have FDA regulations, a lot of different regulations, it really slows down research and development. So a lot of the foreign countries, especially Europe and Asia, they have advances in implant technology that are sometimes way ahead of us because they don't have any of those restrictions, any of those guidelines. So from this chart here, we can see on a per population basis, South Korea actually has the highest number of implants placed in their populations. Next would be Spain, Italy, and if you look at the United States, I think we're like 8 or 9 on this chart. So a lot of new technology out there, a lot of interesting stuff going on. Okay, so let's move back to the autograft and converting tooth into bone. So their claim by VacuSonic is that this creates better bone. Does it create better bone? I can't say yes or no. We've tried it in a few cases, but I can tell you the results that we get are just as good as allograft and xenograft combined. And one thing to keep in mind too, as we mentioned earlier before with allograft, is the reason that these technologies were created in Asia is the fact that there's a taboo in Asian culture of using donor bone, which is essentially human cadaver bone, and having that implanted to your mouth. So because of the restrictions in the culture and also restrictions by the government, these people had to be very creative in terms of how they were going to achieve and be able to create bone. Okay, so as we mentioned earlier, the VacuSonic was invented in South Korea, and one of the reasons behind that is because, as we said before, they have a cultural taboo against using human bone or donor bone, and also there's basically restrictions by the government saying that you're unable to use donor bone for implant dentistry. So given these restrictions, they became very creative in terms of how to get similar allograft or autograft in this case. So let's actually go to the actual case presentation. So one of the cases actually you able to use this. So if we take a look at the first picture on your top left, this was actually, once again, the tooth. After it's been treated, they poke a bunch of holes in it and they decalcify it. After that's done, they're able to insert the implant into the tooth and use it as a block bone. And from that, if you look at picture number 7, they inserted the implant into that space, basically to stabilize the implant. And then after that, picture number 8, they put particular graft or bone graft around the entire area. And then number 9, they sutured everything up. This is basically how we actually prepare the teeth. So these are 2 molar teeth or back teeth in this case. And from this, we're going to process both powder bone and also a block. So for the powder bone, we would just hit it. And after you hit it, crush it, grind it down, you sift through it, and this is your end up results. So from this, we get very fine powder and also some larger strands of particular bone right there from the tooth. From this, it goes into the machine, it gets decalcified, it gets sterilized, and after about a 1 to 2 hour process, you're able to use the bone for bone grafting. This is the block bone. After you treat it, poke a bunch of holes in it, same thing, clean it up, and then after you do that, same thing, you put it in the machine, decalcify it and sterilize it, and after all said and done, this is what it looks like. So just really cool technology, something we show you that in 2018, you're able to take your own teeth and you're able to process it into bone grafting material. Is it better bone grafting material than allograft and xenograft combined? I can't tell you yes or no. It works just as well. The manufacturers, they're telling us all these great things about it. I can't tell you yes or no because we don't have any long-term case studies about it. We're just trying these procedures now, but it's very cool technology for people that have a fear of allograft human bone or they don't want cow bone placed in your own body. Then this would be a good substitute. So not for everyone, because not everyone has teeth that can be extracted to turn into bone, because some people have been missing teeth for a long time, but something cool, something for you to think about. So the last and final topic that we're going to cover today is alloplast, synthetic bone. So synthetic bone, the most common types are calcium sulfate, calcium phosphate, and hydroxyapatite. So these are actually materials that we actually don't use in the office. 10 years ago, we actually used them quite often, but now given the current technology and also with the advent of PRF and PRP and all these blood draw collection technology, alloplast we generally don't use anymore. So alloplast, especially with the calcium sulfate, these are technology that was very popular about 15, 20 years ago. Today, people are using them less and less because the bone that's regenerated from these products is not as good as you would get something from xenograft, autograft, or allograft. So I won't go into too much more details about it here, but if you guys want to know more, feel free to contact us. We'll let you know the exact science behind it and go into a whole nother, we could go to a whole nother video about this subject. Okay? So that's it for today, and that covers all the 4 different types of bone grafting material. So keep in mind, alloplast, xenograft, allograft, and autograft. 4 different types of bone grafting material. If you have any questions, feel free to email us or contact us at help@cerritosimplant.com.